Hi, this is the Injury and Violence video lecture series. Today's talk is Learning from Success Stories. And people always say that you can learn a lot from your failures. And today I want to make sure you understand that there's also much to be learned from our successes, particularly in injury and violence prevention. So about this series, this has been developed through a collaboration between SAVIR and Safe Streets Alliance. It's part of a video lecture series, CDC funded. The aims are to raise awareness about the field of injury and violence prevention and familiarize everyone, really, give them a basic understanding of injury and violence prevention. My name is David Hemenway. I am co-director of the Harvard Injury Control Research Center. The learning objectives for this talk is that at the end of the talk, hopefully you'll be able to explain the public health approach to reducing injury. You'll be able to discuss the importance of data systems and research in reducing injury and to recognize the role that single individuals and groups of associations can play in injury prevention. And this meets the criteria 15. So a number of years ago, I wrote a book called While We Were Sleeping. It has about success stories in injury and violence prevention. It's basically 64 documented successes in the reduction of injury and violence in the United States and throughout the world, and 36 heroes, mostly activists who really have made a difference in reducing injuries and violence. And most, I would say probably all 36 of these heroes you may never have heard of. And the goal of the book was to explain what is public health and to really explain also the public health approach to injury and violence prevention. So the outline today, we're going to talk about the public health approach. We're going to talk about some successes and heroes. One of the big areas of success that everyone in injury control talks about is the motor vehicle area. And also we'll talk about other successes, and then we'll talk about some of the lessons learned. So what is the public health approach? What I believe is the public health approach, if someone asked me to give a one-sentence description of the public health approach, I would say it's, let's make it easy for people to stay healthy and difficult for them to get sick or injured. So I've done a little work about obesity in there. I would argue that the public health approach is to try to make it easy for people to get a really healthy meals, to have a healthy, balanced diet, to make it really easy for people to get good exercise, to make it really difficult for people just to eat terrible food, and to make it difficult for them to become couch potatoes. In the United States, we tend to do just the opposite, and yet somehow we're surprised when we have such an obesity problem. Now, I would argue that the key elements of the public health approach, the most important one is that public health is about prevention. When in doubt, it's about prevention. We're going to try to prevent injuries and violence. What we've learned in looking at so many different injuries is that to effectively prevent them, it's almost always better in terms of efficiency and cost effectiveness to go as far upstream as possible. Any injury or violent injury, there's probably dozens of things that could have been done to prevent that injury, and we're looking to do the most effective and cost-effective ones. And these are typically not to wait till the last second to try to prevent. The public health approach is population-based. It's not one at a time like most medicine is. It's not one at a time like most criminal justice is. We don't really know who we're helping, and the people who are helped don't know individually that they've been helped by public health interventions. When I try to explain the public health approach, sometimes I use the example. I have occasionally gone into Boston and talked to groups of psychiatrists about how to reduce suicide. And one of the things I talked to them about is I asked them, why do they think in Massachusetts, where they are, that there's so many fewer suicides in Massachusetts than there are in Arizona, which is about a similar size state. And they're interested in that, but they've never really thought about it because that's not what they're in. That's not what their focus is. Their focus is on helping individuals, not looking at populations, whereas public health really is to look at populations. And when I push them to think about why might that be true, they have all these answers having to do with mental health, the notion that, well, maybe the sun is a problem, maybe the immigrants are different than the immigrants in Massachusetts, maybe there's not enough psychiatrists there or whatever, that somehow they must have more mental health problems. But in actuality, the evidence is that they don't have more mental health problems, but they have more suicides. Why? And the answer is something else other than just their mental health. It's that they have such easy access to firearms. And so we're looking at understanding populations. We're also, the goal is not necessarily to 100% fix the problem, which is not going to always be possible. It's really harm reduction. And we're happy when we can reduce the problem, when we can save anyone's life, we can save anyone the misery of very serious injury. It's a systems approach, and we'll talk about that because it's not just looking for the one answer, the one thing that can solve all the problems, because typically, particularly in injury and violence, there are lots of things which can be done, and we're trying to do a whole variety of things to reduce the problem and do the ones which are most cost effective. One of the big things I think about public health is that it's broadening and helps you think more about the types of interventions that can be used. And it's also think more about the type of institutions that can get involved, that can play a part in prevention. We're always interested in not pointing out who's to blame, but to get allies in our work to have more shared responsibility, to try to figure out ways to get everyone involved in reducing injury and violence. Too much in the United States, the focus is always on something bad happens, who's to blame? Let's find out who's to blame. And then that's it. And it means that most people who they say, oh, it's not my fault, I don't need to do anything. But what we're trying to do is not to find blame, but to prevent. Occasionally, finding fault or blame is helpful for prevention, but often it's detrimental to prevention. And our focus is prevention. It's hard to be in public health and not to be an optimist because there's been so many successes over the last 150 years in public health. Indeed, a principal reason why we live twice as long as the people did 150 years ago, why we are so much healthier throughout our lives, is because of public health successes. We've had great successes about infectious disease, about tobacco control in the United States, about reducing lead poisoning, fluoridation. When I was growing up in the 50s, all of my friends and myself, we had lots and lots of caries, lots of cavities because the water wasn't fluoride, it didn't have fluoride, and neither did the toothpaste. When I was growing up in the 50s, most of us got measles and mumps and whooping cough and so forth. Why? Because we didn't have good vaccines against infectious diseases. And these are some of the great successes of public health. And I want to talk today about some of the successes, a few of the many, many successes in injury and violence. Now, what you'll see is injury people talking a lot about the motor vehicle success story. At the turn of the 20th century, the Centers for Disease Control was asked to talk about the 10 great public health accomplishments of the 20th century, and there were so many. One of the areas they picked out for injury and violence is what happened in motor vehicles. And this is the story that we tell our graduate students sitting over the campfire and trying to pass on this information, the knowledge we gain from the great successes in reducing motor vehicle injuries in the 20th century to our graduate students who can then pass them on to their graduate students and so on. So, in terms of motor vehicle injuries, when I was growing up, we were told, and it's sort of correct, that virtually all motor vehicle crashes are due to driver error. It's the driver's fault. Why can we say that? Because if drivers were perfect, if they never made mistakes, if they always behaved themselves, if they never got tired, if they never got distracted, if they never got angry, that if drivers were perfect, there'd be almost no motor vehicle crashes. A few crashes might be caused by a wheel somehow falling off the motor vehicle, but almost all of the crashes are caused by, or due to, or could have been prevented if drivers were perfect. And so because of that, the motor vehicle industry and others were saying, oh, the best policy, what we ought to do is train and educate drivers. And if we only did that, if we only could make drivers perfect, we wouldn't have any problems about crashes. I was one of a cohort that we all had to take in high school driver's training. And what we've learned subsequently by good studies is that driver's education doesn't seem to have any beneficial impact on the likelihood that the driver will be in a serious accident. Also, we were told in the 1950s, and it's true, that most motor vehicle deaths are associated with clear, deliberate, unlawful behavior by motorists. Motorists were deliberately breaking the law. And if we could get motorists to never break the law, we could reduce motor vehicle deaths probably by 3/4 or more. What do I mean by break the law? Speeding. Have you guys ever sped? If you're speeding, you are breaking the law, and speed has a lot to do with the likelihood of death. People drink a little and drive. People run red lights. If we could eliminate people talk on the phone when they're driving or text, which is illegal in most states. If we could eliminate all that, we would eliminate most of the motor vehicle deaths in the United States. And so the policy implication, oh, we ought to enforce the traffic laws. Education and enforcement, education and enforce. This was the mantra for a while. This currently is the mantra of the National Rifle Association. And it's policies which don't seem to work very well. It's not that they don't work at all, but they don't make a big enough dent in the problem. It wasn't until public health physicians asked a different question that we could see incredible changes in motor vehicle deaths in the United States. Instead of focusing on who caused the crash, they asked a different question, which is what caused the injury? And it was clear that a lot of drivers were being killed when the steering wheel, which is like a spear in a head-on collision, would go right through their chest. A lot of occupants, especially in the front seat, were being killed when in a front crash, heads would go right through the glass, which was not made of safety glass, through the windshield. They would often leave the car, get thrown from the car, and their heads would hit the cement, or their heads would hit the car, and they would die. Sometimes they would leave the road for a second. A mom hearing their kids in the backseat would turn their head around and the car would go off the road for a second and they'd hit a tree or a lamppost, which had been planted along or placed right along the side of the highway, and they would die. And public health physicians were saying, why are we putting lampposts? Why are we putting big signs along the sides of major highways? We're not putting lampposts along the runways for airplanes to crash into them. Why are we doing this for highways? And we can do a lot better. We can make the highways better. We could make the roads, we could make the cars better. And the punchline is that over the last 70 years, cars have been made much safer. Roads are safer. The emergency medical system is better. Fatalities per mile driven have fallen an incredible 80 to 90%. And nobody thinks drivers today are better than they were when I was growing up. Drivers today are better about drunk driving. Drivers today are much worse about distracted driving. But somehow we've had this incredible success story. And so one of the many key insights to the motor vehicle success story, and again, it's a continuing success story. We ought to keep continuing to do better and better and better. But the key insight is you don't always have to change people. You can blame people if you want. But if you want real prevention, it's much more cost effective to typically go upstream, to create a system where it's hard to make mistakes, where it's hard to behave inappropriately. And then if some people still make mistakes and still behave inappropriately, that no one will seriously be injured. You want to have a system so if you're about to go to sleep in the car because you've been up so late and, oh, you shouldn't go to sleep, you go to sleep, it's your fault when you go off the road. You want to make it so maybe you hit bot stops, bah, 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 which wake you up and it says, wake up, stupid, get back in line. Or you want to make it so the car, it starts ding, 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 wake up. Or you want to make it even if an old car, you go off the road, you don't hit a tree. You go off into a field and no one's ever been killed losing control of the car and going off into the field. You want to make it hard to make mistakes. You want to make it hard to behave inappropriately. And then when something terrible happens and you really do crash, you want airbags and seatbelts and so forth to help protect you. So one of the big heroes in injury and violence prevention is Bill Haddon. Bill Haddon is known for years ago, before there were many studies about motor vehicle fatalities and prevention, there'd be conferences, and you'd have supposed experts giving their presentations, and at the end, Bill Haddon was raise his hand and say, "Where are the studies? Where are the studies that show what you're saying is true?" And there were almost no studies. And Bill Haddon was one of the first to start doing studies. And what he found out with real science is that a lot of things that the supposed experts were saying were true, but a whole lot were false. And a whole lot of the things that they were claiming people should do or that policy should do would make things worse rather than better. Haddon was also a doer. He became director of the National Highway Traffic Safety Administration. And under him, a lot of major changes to cars took place. They required cars, for example, to have seatbelts, which they didn't before. And then he became president of the Insurance Institute for Highway Safety and did lots of incredible research and advocacy to make cars and roads safer. One of the successes is the collapsible steering column. Collapsible steering column is incredible because it saves the lives of drivers. Now, it doesn't save the lives of passengers, and it doesn't save the lives of bicyclists, and it doesn't save the lives in rollover collisions and rollovers, for example. But in head-on collisions, it will reduce the likelihood of death, not only serious injury to lots of drivers, but death by about 12%, which is really, for something that costs almost not pennies, it's a real success. Now, I showed this picture again because this basically is my first car, which I learned to drive in 1959, 1960. This car, it had no seatbelts. It had no airbags. It had no collapsible steering column. It did not have a crash-worthy interior. When you went into the dashboard, you would get seriously hurt. It didn't have laminated safety glass on the windshield. But what it did have, if you look carefully, is these little knobs, all these knobs for everything. If you wanted to turn on the radio, if you wanted the windshield wiper go on, whatever. And it was terrible. These knobs were just the size to fit in your eyeball. And it was like, my father was a mechanical engineer, and I'd say, why do they do this? Can't they do better? And he'd say, sure they can. But that was not their interest. Their interest is in selling cars, and consumers don't know enough about it, aren't thinking about every aspect of safety when they're buying a car. Now, in the past 25 years, though, things have really changed because of groups like the Insurance Institute for Highway Safety and the National Traffic Safety Administration, who are doing lots of crash testing. We're doing lots of real-world data analysis on which cars are safer and which cars aren't, so that if you care about safety, you can get all this information and you can buy safer cars. And it's forced the automobile industry to start competing in terms of safety. And so in the last 25 years, the automobile industry is starting to compete in terms of let's have automatic emergency braking, let's have lane departure warnings, let's have rear-facing cameras, let's have electronic stabilization controls. And one of the things I care a lot about is blind spot detection. For the last 40 years or so, I always said, what are automobile manufacturers doing? We're always taught to, if we want to pass someone, we are supposed, there's a blind spot over our left shoulder where there might be a car, and we're supposed to turn, put our head away from where we're driving, which is you never should do, and make sure there's no car there. And by the time you get back, you've traveled maybe 100 yards. Couldn't we do better than that? Isn't it easy to do? And my father's a mechanical engineer would say, sure, it is easy. And finally, we've done something. We, meaning the United States, we, meaning on the US automobile industry. And that's really good. There's so many things we can do to make cars even safer, to make cars even safer for pedestrians but motorcyclists and bicyclists, which they are. They're very unsafe. Now, one of the things that's important to learn from all the success stories was, and I was so pleased to find this out, is that data and research in almost all the success stories mattered. Data and research were actually very important in terms of so many of the injury and violence successes. Among the many things that data and research do is that they provide information that there's a problem. Here's the data. The data really show that there's lots and lots of people who are being injured and dying from this. And so maybe we should do something. And then what people don't understand always is the data tell the types of policies that might work. Some policies might work better, some might work worse. And the disaggregated data give you lots of hints, lots of suggestions, lots of indications about what might work. And finally, of course, the data are crucial if you want to figure out, did these policies and programs have an effect that you wanted? Let me give you an example. Anecdotally, people knew that 16-year-olds were at high risk. At least individual parents knew that their 16-year-old driver was scary. But it wasn't until we had a good data system that it became very clear how scared they should be. Because it turns out, in terms of fatalities per mile driven, 16-year-olds typically had 3 times the likelihood of being in a crash where someone was killed than a 19-year-old. And 19-year-olds are just terrible drivers. And 16-year-olds had 10 times the likelihood of dying when they were driving a motor vehicle per mile driven than a 40-year-old would. And so it's like, gee, something needs to be done to protect these children. And what could we do? It takes a while to learn how to drive. We don't have enough simulators or to make sure kids are able to have really perfect simulators and work on them for tens and tens and tens of hours. So we put them on the roads. Now, what the data and research showed is that there were 2 times when teenagers were at very, very high, the highest risk for serious injury. And that is 1, when they were driving at night, and 2, when they were driving with only other teenagers in the car. And so the state of Michigan, following the example really of New Zealand, said, all right, here's what we'll do. We'll let 16-year-olds drive after they've had training and so forth. But for the first 6 months, we will only let them drive when it's not at night, when they won't be allowed to drive at night, and they won't be allowed to drive when there are only other teenagers in the car. And then, once this policy was in effect, very quickly, good data and research showed that crash deaths per mile driven of these 16-year-olds fell by 30%. Now, not 90%, which would be nice, but by 30%, which is a lot of kids saved. And so other states said, oh, we can try this. Florida did, and North Carolina and Ohio. And again, the data and research showed you're saving about 30% of these children who otherwise would have died. And so very quickly, all 50 states adopted graduated driver's licensing, and we saved a lot of 16 and 17-year-olds. I want to talk a minute about the importance of standards and certification. I do this, I think, because very few people understand what voluntary standards are. I'm an economist by training. I wrote my first book in the 1970s about voluntary standards, and still voluntary standards play such an important role and still in our economy and for safety, and still most people in injury prevention and most economists have never had any knowledge about what these things are. The first automobile safety standards were voluntary standards written by the Society for Automotive Engineers and then made mandatory by the government. If you look around in almost any building, there's all these safety standards. They were once voluntary standards and then made mandatory. And without this voluntary ones, it's very hard to create the mandatory ones. Standards and certifications play an incredible role in reducing injuries. Another hero, this is a friend of mine about my age, a guy named Andrew McGuire. Andrew, when he was young, had a very serious burn injury. His clothes caught on fire. And he only has a bachelor's of arts, but he said he's going to devote his life to trying to make the world a better place. He's become an advocate. And one of the many things he did, the first thing was in Massachusetts to make sure that the pajamas of children were less flammable than they had been. In Massachusetts, because of him, passed a law saying that you can't sell the kinds of flammable pajamas that people were tended to buy. Because if you're a consumer, you can't spend all your time and energy trying to do lots of research to figure out which pajamas are more or less flammable. And so Massachusetts banned the most flammable pajamas. There were lots of other pajamas which were less flammable, and the number of kids being seen at Shriners for serious burn injuries fell dramatically. And then Andrew tried to find out what else are very, very serious problems from fires. And it turns out at that time, the most serious fire problem was a residential fire problem, which was people smoking in bed, drinking, falling asleep, and the cigarette didn't go out, and the mattress either caught on fire or just smoldered so much that the smoke would kill not only the drunk who's in bed, but their family and kids. And it's like, what can be done? And of course, the immediate reaction of everyone is, let's do something about that stupid person who is drinking and smoking in bed. Don't drink and certainly don't drink and fall asleep, and don't drink when you're smoking a cigarette, and maybe don't smoke cigarettes, and on and on. And those are all good things, but they aren't necessarily that effective because people don't always follow these rules. Instead, what you can do is actually prevent. You can actually really effectively solve the problem, because going upstream is often so much more effective and cost effective than just waiting around and seeing when people don't behave perfectly. And nobody ever behaves perfectly. And so there were some cigarettes which are actually manufactured somewhat inadvertently, which were pretty fire safe. They never burned hot enough to ignite upholstery, or they went out before they had ignited upholstery. And Andrew promoted what was called the Fire Safe Cigarette Campaign. And he was trying on and on to make it so only cigarettes which were fire safe, which wouldn't burn up, which were at least much less likely to burn up people. And I would see him at injury gatherings, and every 2 years, I'd see him and I'd say, how's it going? He'd say, it's really going, we're moving. It's going to be 2 or 3 years from now, and we'll have it. We'll have it 2 or 3 years from now, and we'll be able to, there'll just be fire safe cigarettes every place. And this began in 1980, and then 1984, 1988, 1990, 1992, on and on. And along the way, he would say, oh, now we've gotten a voluntary standard for how to measure safety. First, we had to figure out how to measure the likelihood that you could have a fire-safe cigarette, and then we'd had to create standards for and be able to certify it and so forth. And then finally, in 2004, I said, "How's it going?" He said, "New York's about to pass a fire-safe cigarette act." And it did. It said, if you want to sell a cigarette in New York, it has to be fire-safe. What do most of these cigarettes have? They just cost the same amount. It looks the same. It smokes the same. The only difference is for most of these is you have the paper. There's a little speed bumps, they say, so that if you don't puff for 90 seconds, then the cigarette will slowly go out. And that's all you need to stop most of these fires in Canada in 2005, California in 2006. And once California and New York required all cigarettes to be made fire safe, then the cigarette companies said, okay, this is what we'll start doing. And by 2011, all 50 states had fire safe cigarette laws. And there's been, because of that, fewer fires and fewer of the most dangerous fires, which are these kind of fires when people are asleep. Let me talk about other heroes and other successes. Paul Vinger and Tom Pashby, they were eye doctors. Paul used to come and teach in my class. He would spend 30% of his time doing pro bono work, really working on standards writing committees to make sure that the standards which were written for eye safety were not just written by the manufacturers, but were written for safety of individuals, not to increase sales, but to make the individuals who are buying the equipment safer. I'm going to talk about Tom Pashby in Canada briefly. One of the things he did in 1972, for the first time ever, he was the one who collected data on Canadian youth hockey eye injuries. And of course, hockey is a big sport in Canada, and all these young kids were playing. And in 1972, he documented that there were 287 eye injuries among these little kids and 20 blind eyes caused by their playing in hockey. And he was thinking, can't we do better? This is terrible. And he worked along with Vinger, and they helped to write the standards with the American National Standards Institute and American Society for Testing and Materials, and then to figure out how to certify and so forth. They figured out how to change the rules of the game. They made sure that at this level, they got rid of high sticking and so forth, and they had kids wear masks. And by 2000, there are only 6 eye injuries and 1 blind eye, and 1 blind eye was to someone who's not wearing certified equipment. So a big success story, but there are always people fighting. It didn't say, oh, we're going to do this immediately. There are people who have financial interests to try to prevent what we think in public health is a good way to prevent injuries. And there are people who just have tradition-bound resistance. Oh, this is the way I played when I was a kid. Oh, yeah, no, I almost lost my eye, but my son can do the same thing. It's like, no, we want to save not only your son, but also lots of other kids who would have otherwise had serious eye injuries playing this simple, fun sport. Let me give another example of a success. In criminology, this is called crime prevention through environmental design, or CPTED. And it's not promoted enough in criminology. Criminology still spends much too much time. They should spend some time, absolutely, but they spend almost all their time thinking about who's going to become criminals, how can we stop people from behaving badly by sort of training and whatever. And there's a lot of things you can do to make the environment better, to make it less likely that people will want to commit crimes. And when I was in Washington, D.C. in the early 1970s, they were building the D.C. Metro. And one of the great things is that they decided to build a safe metro, because it was pretty well known that there were lots of assaults and robberies, rapes, and even murders occasionally in a lot of the metros throughout the world. And they said, what can we do to make ours? We're going to build from scratch. What can we do to make the metro we create safe? So we'll have fewer robberies, fewer assaults. And they went to all the major metros throughout the world. They went to the New York subway system in Boston, and they went to Chicago and talked to people. They went to London, they went to Tokyo, and they talked, where do you have these assaults? Why do you have them? What could you do? If you could start from scratch, how would you change your data, your metro to make it so that it would be safe? Get rid of the long, winding hallways. Make it light. Make sure that people aren't loitering around. So the DC Metro, you can see, there's no places where you could assault someone where people didn't see. There's no reason to loiter because there's no sort of fast food places. There are cameras all over. And so at least I haven't kept up with this recently, but in the first 25 years of its existence, the DC Metro had much lower murder, rape, robbery, and assault rates than New York or Chicago or Boston. And why? It's not because the people there were nicer. It's not because they have fewer criminals, whatever. It's because you made it so it's harder to assault. It's harder to rob, and so fewer people will do that. And they made a much safer metro system. You have the same approach in medicine. In the early 1980s, anesthesia, the anesthesiologists had the highest rates of malpractice. Why? Because they were killing lots of people. And it was like, oh my goodness, this is terrible. What should we do? And in the 1970s, what they did was, let's find that doctor who made a mistake. Let's find that nurse who made a mistake, and let's, get rid of their license and do it over and over and over. And it's like, this doesn't seem to be working very well. Let's do something better. Let's make the system better. Let's make it really hard to make mistakes rather than easy. Let's make it so instead of having some machines when you push the button up, it goes off, and some machines when you push the button down, it goes off. It's like, no, let's standardize those. Let's make it so whenever you start doing something wrong, bells and whistles will go off and saying, wake up, stupid, stop doing that. And you stop doing it. And so that's what they did. The medical malpractice insurer at Harvard got all these smart doctors together and said, how can we create a system so it's really hard to make errors and really easy to do what's right? And they did all these little changes. And it's not like doctors are better well-trained anesthesiologists. It's not like, oh, they're much smarter, they make fewer. It's because the system is so much better that within a 20-year period, deaths under anesthesia fell like 98%, an incredible success story. So there are lots and lots and lots of lessons we can learn from the success stories. One of the things about, and I'll just talk about some. One of the things about public health is that I believe it's really broadening. It broadens your perspective. One of the many ways it broadens your perspective is it makes you understand that there are so many kinds of policies and programs that can help improve public health, reduce injuries, reduce violence. One of the things to recognize is government does lots and lots and lots of things which matter in terms of whether or not people will be injured. There's so many things about housing and so forth. I just want to talk about a few other things. So not only do they create rules and regulations, but they create and maintain data sets. Without good data, it's really hard to know what's going on. It's really hard to have good policy. Government funds its own research and also conducts research, conducts basic research, and funds research. These things are incredibly important. The government disseminates information. Surgeon General reports about the cigarettes and cancer made a huge difference in the United States by disseminating the information that had been done with the data and research by private individuals, often funded by government at universities. The government can promote the creation of voluntary standards and certification. Again, that's a key reason we have fire-safe cigarettes now. Also, I'd argue the government is not only produces things like roads, so how safe the roads are is a government function. It's also a big purchaser. One of the big reasons we have airbags in the United States is because of government purchases. Years ago, the automobile industry fought for 20 years putting airbags in cars. They said the airbags won't work. We're not going to do it. You can't force us. They filed suit after suit to prevent the government from requiring airbags. And one of the things they said, the airbags don't work. Show that they work. And there weren't any cars with airbags, so it's hard to show it. But then the government said, all right, we'll help. We're going to buy 4,000 cars and only cars that have airbags. And an insurance company said, we'll buy another 1,000. So there are 5,000. Anybody who wants to sell us a car with an airbag, we'll buy 5,000 of them. And Ford said, okay, 5,000, that's great. That'll help our sales. And they did. And so you had 5,000 cars driving around with airbags, and it saved lives. And so no longer could the automobile industry say airbags don't work. So there's so many things that the government could do. One of the things which public health promotes too is that we could get everybody involved. Instead of seeing groups as the problem, we see them as part of the solution. And there's so many examples about when different groups, if you can get them interested, you get them excited, get them understanding that they can play a role in making society better. The faith community. There are lots of examples in the book about how the faith community has helped. Universities, foundations. We work with barbers. Physicians and physicians associations matter. Insurance matters. Hollywood has mattered, has done things like promoted the designated driver campaign. The media matters. People have worked with Red Cross, with 4-H clubs. And of course, what you really want to is the manufacturers to do more, to do better, and the retailers and the trainers and the owners and so forth. So the conclusion I have is this, and I tell this to all my public health students. Injury and violence, it's still a major public health problem in the United States. If you die before the age of 40 in the United States, you are more likely to die of an injury or violence than you are from a disease. Injuries and violent injuries follow predictable patterns. You can use science, they're not just random. You can use science to figure out where they're going to be. And these are almost always preventable. Good data matters, research matters, and almost all the successes have been due to changing the environment, because it's so much easier to change the system than it is to change people. Rather than finding individual fault by those people who have the last clear chance, and you can do that if you want, but if you really want to prevent, typically what we have learned is that the best way is to go upstream and change the environment. So it's hard to make mistakes rather than easy. So it's hard to behave badly rather than easy to behave badly. Public health prevention really matters. Individuals and institutions can make a difference. They have made a difference. One of the things I always try to emphasize is that change takes much longer than you hope. All these successes, there were people fighting against them. It was pushing and pushing and pushing, trying to make the world a better place. And then suddenly something tipped and things got much better. One of the things I want to emphasize too is that you may, if you want to go into public health and injury and violence prevention, there's neither fame nor fortune. Nobody will know what you did. All the 36 heroes, basically, most people have never heard of any of those people. They're not making money. If you do something that makes it so, if Andrew McGuire has done something so that some little kid doesn't get burned, nobody knows that he did that. Nobody knows what the thanks is. Oh, I was, my kid went today and they didn't get burned. Isn't that nice? And the answer is, yeah, it really is nice. And it wasn't the way it used to be 60 years ago, but it is the way it is now. But nobody knows that. And there's neither fame nor fortune. And I promised my publisher I would always push this book. It's only about $20 on Amazon.com. But if you really want to understand what the public health approach is and what we can learn from success stories in the injury and violence world, you could read this whole book. Thank you. And if you want to contact me, here's my contact information. Thank you.